my business. Drink water and mind my business. Who me? I don't watch people, man. I'm looking for house and land. Who me? I don't watch people things. I's a queen. I have my own king. Some of them just talk the most, like they know it all. Ask them how they get their Gucci purse. I go drink water and mind my business. Mind my business. Drink water and mind my business. Mind my business. I go drink water and mind my business. Mind my business. Drink water and mind my business. Me and them can't be friends. I fight the battle and Jah give me health and strength. Now it's we. That can't be English, that had to be French. Some of them just talk the most, like they know it all. But if the ground water slip and I fall, it's them so I go drink water and mind my business. Mind my business. Drink water and mind my business. Mind my business. I go drink water and mind my business. Mind my business. Drink water and mind my business.
Good morning, everyone. Welcome to this latest installment in the GHAI School Feeding webinar series. And actually, I should have said good morning, good afternoon, and good evening. It is my absolute pleasure to welcome you all this morning and introduce you to this powerhouse panel that we have from the Heart and Stroke Foundation of Barbados. These ladies will be taking us through the work that they have done to support the implementation for the school nutrition policy in Barbados. I have with me this morning Francine Charles, the program manager, Stacia Brown, the communications officer, and Jan Phillips, our advocacy officer. Without further ado, I'm going to hand over to Francine, who's going to take you through the first presentation. I want to remind everyone, introduce your name, organization in the chat, but also feel free to use the Q&A for all of those questions that I'm sure are going to come. Francine, over to you.
Hi, good morning, everyone. Morning, maybe afternoon in some places. Thank you very much for this opportunity. And I'm going to start the team off really just kind of looking a little bit at the policy, a little background, but also sharing a number of the key strategies that we felt were important and helpful in advancing our advocacy. Danielle? So it's important to note that the Heart and Strokes program with GHAI started in 2018, and our team joined in 2019. And at that point in time, the focus was the specific policy to advance the banning or removal of sugar-sweetened beverages and unhealthy foods from schools. We were able to ramp that up to the actual approval of a school nutrition policy by 2022. And by 2023, it was announced that the Barbados School Nutrition Policy would in fact be launched. And in April of this year, it was actually the start of the implementation. What was particularly pleasing for us, because of the focus of our policy ask, was that in terms of launching the policy, it will be a phased implementation. But one of the very first things that the government announced is that it will be mandatory for all beverages in schools to be unsweetened with absolutely no sugar or artificial sweeteners added. So that was huge for us. Next. Now, as I said, the policy is actually quite detailed and actually a very strong policy on paper. There are 6 pillars, main pillars. The key ones, obviously, food service environment, which is going to identify and has identified what will be allowed to be sold and to be accessible in the schools and in the immediate environs. Another critical one is the school curriculum, which is going to be the efforts to integrate the ideas of healthy living and nutrition and physical activity integrated more into the curriculum, not just as specific subjects, but within other areas or other subjects. Health promotion for the community, which is where the government will identify the key stakeholders in the school community and ensure that there's ongoing promotion and education. And the school recognition, which is a key one for us, and Jan will speak to this, is that inside of there, rather apart from or in addition to the obvious penalties and breaches that we will have, there will be systems set up to recognize and reward schools in order to ensure some momentum around the promotion of the particular ask in terms of the nutrition guidelines and the guidelines towards physical activity. Next. So in terms of one of the key things I think Barbados did, the Heart and Stroke, was that we tied the policy ask for childhood obesity, we tied it in very, very closely to a very significant issue and challenge for Barbados, which was important at both the government level and at the public level. And that was the issue of non-communicable diseases and the critical issues that we are facing, like a lot of countries, in terms of the effect, 8 out of every 10 deaths in Barbados is due to an NCD. And of course, it's also hurting the national purse strings as well. Next. And so we went about and garnered as much data as we could. There was school audit information that was done in 2019. Daniel, keep clicking, which was able to show that we have a significant issue in our school environment in terms of the proliferation of ultra-processed foods, as opposed to the accessibility of healthier foods, vegetables, and fruits. Go on, Daniel. Click one more and then click again. We had a survey done, a CADRACE poll, which was one of our researchers in Barbados, did a poll that was able to show that there was indeed public concern for childhood obesity and that people did feel that government had a role to play. So we pulled all of that information together. Next. We garnered support by asking people, would they support some of these WHO policies in terms of the school environment? And even the restriction of unhealthy foods and beverages actually got a high percentage of support. So we took all of that information and began to use it as one main message. And we did a lot of work in the schools. We did a lot of work at various campaigns. And we also did a lot of work meeting with stakeholders. But I think the key for us was that HSFB did not do it alone. Next, Daniel. The key for us is this group. It started as a small group in 2019, but now we have up to about 25 civil society organizations, as well as about 20 other passionate and expert individuals who actually work together under what we call the Barbados Childhood Obesity Prevention Coalition. And together we have decided full support for policies like the school nutrition policy. Next, Daniel. And together we are one voice. And that voice has been very significant throughout Barbados because we have been on the media, we go to the schools. You can go next, Daniel. We go into the schools, but we also operate in our spheres of influence as well. And so it's been quite, this for us has been a very significant part of our process. Next. And then a clincher. Now, this is important for us because it was more to do with what works in Barbados. And at this particular juncture in our history, our government really puts a lot of weight on the youth voice. And so we garnered youth from the university, from other areas. We shared with them the concerns that we were having, and together they pulled together a strong youth advocacy arm, which is a part of the coalition. And they hit the digital media. They did open letters to government. They've been in the schools with us, and they have been doing their work. We've ensured that they have had training in how to deal with the media, in other areas of capacity development. And they have been a clincher for us in terms of attracting, I believe, the policymakers, especially around the school nutrition policy. Next. And this area, I think it kind of redounds and the whole issue of collaboration, which we've done as a civil society, then moved into how we operated and engaged with the government. What we noticed was that apart from the ministers who you make efforts to bring them on and to bring them as champions, there were already champions sitting down inside of our ministries, technocrats who are either very passionate about these issues or who also have been working on these issues. And we really pulled together a team And I believe at least maybe one or two of those technocrats are here in the in our audience today. And so for us, what we found that worked in Barbados was not so much the issue of confrontation, or they knew that we are watchdogs and that every time something came up, they would hear from us. But there was also a sense of collaboration with the technocrats that I think has made a big difference. They know the system, they understood it, and they also knew what they needed to advance the process. And so I use this particular picture because this was a program in March 2023 on a very popular radio station that we did towards the implementation of the SNP. And here we had a minister of government, a technocrat in the Ministry of Education, and our coalition members. And you could not tell the difference. Everybody was on message, saying the very same thing. And I think it has been key to our advancing of the school nutrition policy. Next, Danielle. Another area for us was identifying gaps. So what we found was that it wasn't so much that no one wanted to do the school nutrition policy or to create, to ban stuff in the schools, but there was a lot of areas or difficulties or complexities that caused delays. And we said, what are some of these areas? And one of them was, but if we took out all these things from the schools, what would children drink? What would children eat? And it was all of this discussion. And so a team within our coalition of nutritionists and medical doctors, they mapped the supermarkets. They went to all the supermarkets, identified what's available, and said, look, at this point, we probably can't have a 100% healthy list. But what we could show parents and canteens is an alternative list of things that we would recommend that they provide their children. And we did this pretty much as a way to say, we don't have to delay the process. We can phase the thing in. And it became a very handy tool for the Ministry of Education and actually has become an updated list as we moved into the implementation. Next. So it showed them the drinks, very specifically what kinds of drinks and what kinds of snacks. Next. The other one was the issue of monitoring and evaluation. How do we monitor and evaluation? Is very expensive. There was the discussion about, what's the sense of starting if you don't have a monitoring and evaluation system. So what HSFP did was that we thought, what could be an easy, quick approach to this? And we commissioned a local app developer to create an app for the phones, a school monitoring app. We shared it with the Ministry of Education. They felt very good. They had us to present it at the launch. And it was able to allow officials, civil society members to randomly go to schools and be able to check on what's happening in the schools, what's being sold in the vending machines, physical activity, what's going on, etc. And it would identify breaches as well as best practices. Next. And it's on the phone in a survey format, so it would ask you things very quickly, what food items are available, what are you seeing? And it would generate a report at the end of the month. At this point, we have not been able to execute the monitoring app. We are waiting for the Ministry of Education to give us the green light because there's obviously training and other issues that have to go into this. But we feel that this is going to be a very important part of the process. But it helped to move the process because they were able to see solutions to some of the gaps or the issues that were being brought to the forefront. Next. And a huge learning for us. And I think this is a part of the process that we are in right now. So the school policy was implemented in April. What we realized as civil society is that it would not be possible, definitely not in our small territories where there's a lack of resources, even within the ministries, to be able to say, oh, we've gotten a policy, it's a big win, and to move on. We obviously had to support the implementation and will continue to support it as much as we obviously can. And so what we did was we started training the school meal servers. We were doing support and sessions with the canteen concessionaires to help them. We continue to work with them. We were invited to a lot of outreaches by the PTAs, the parent-teacher associations, to be able to guide parents on their process. And so we have been doing this work in various areas and as requested by the ministry. Next. And then the key stakeholder, the children. And so there's been a move to do a lot of sensitization in the schools, specifically about the school nutrition policy and why it's important and why you should support it. and HSFP and the coalition are responsible for sensitizing all the secondary schools around the country. So I end here next, Daniel, just with a quote from our Prime Minister that I think kind of, in a way, sets the tone for the work that we did, kind of describes it very well, is that if we want to win this battle, as we have done with other diseases in our history, then the time for collective action is now. And we've taken up an approach to collaborate as much as we can while maintaining a watchdog position within Barbados. Thank you.
Thank you so much, Francine. I'm sure everybody's just bursting with questions. A reminder, please put your questions in the Q&A. We're going to have a special Q&A section at the end. And so I'm going to hand over now to Jan.
Thank you very much, Rachel. And it is great to be here this morning to present to you on our school nutrition policy, within which falls the model school program. Right, so let me jump right in. So I'm just going to give it to you at a glance. Next slide, please, Daniel. Right, so the creation of the model school program was done in 2019. We started with the Heart and Stroke Foundation at 2018, advocating for policy change, calling on policymakers to restrict the sale and marketing of unhealthy food and beverages in and around schools across Barbados, which led us to creating the program as a pilot project to show policymakers a roadmap on how the policy could be rolled out in schools. Next slide, Anna. Right, so the goals of the program were to create a healthy school environment by galvanizing support of the ministries of health and education and the general public, encourage commitment to the removal of sugar-sweetened beverages and unhealthy foods from the school environment and over time from the students' diet, to encourage and support students to input physical activity into their daily routine and encourage the use of water. Next slide. Next slide, please. Thank you. Oops, go back one. Right, so in 2019, a school audit was carried out by the Caribbean Institute and Health Research on 24 schools in Barbados and 15 primary schools, and primary schools would be from 4 to 10 years old, and 9 secondary schools, and that would be from 11 to 16 years old. And at a glance, it gives you the canteen concessionaires, what they sell, as opposed to what the street vendors sold. And if you look carefully at the sugar-sweetened beverages, you see the infiltration of sweetened beverages throughout every area. Then the snacks, we have a high percentage of snacks being sold at the canteen and the street vendors. The non-SSB options, not including water, not so much. Vegetables, no, not so much. And then the fruits also, not as many. So we need to change that, but this was good information to start what we needed to do. Next slide. Right, so the development pillars we used of the model school program was very importantly policy implementation, education and advocacy, policy support activities, and also very important, monitoring and evaluation. Next slide. So I'm going to break all that down for you. So pillar 1 was the policy implementation, and it called for written commitment from the school management. So here in these pictures, we have the principals of the schools chosen as the model schools. And it was fairly easy to choose these schools as they were already doing stuff on their plan to create a healthy environment. So it called for them, lock, stock, and barrel, to agree to be forerunners in creating the policy-based healthy school environment. And that included the very difficult task of removing the sugar-sweetened beverages from their school. And we started with the sweet drinks because we thought that to remove what you could probably call sodas and the juices at the same time would have been kind of a bitter pill. So we started with the soft drinks and they went right in with that. Next slide, please. Also in policy implementation, We had one coalition coordinator assigned to each school so that they could monitor what was happening. And then we also had our nutrition team training canteen concessionaires and vendors and provide ongoing support. And this is absolutely key. Our training with the vendors and canteen concessionaires is ongoing. We did one as recently as this school term. We did one in September, and it is always very well attended, and they are certainly on board. Next slide, Daniel. Pillar 2 was education and advocacy, so the onboarding of teachers, parents, and students via sensitization sessions, via outreach and PTA sessions. And here you have the engagement of the principals and teachers at a school. And then we also have a picture of the Parent Teachers Association and the outreach for the children. The information shared is always interesting to them, and they are willing to come on board, but they just need to know, they just need the correct information. Next slide. Pillar 3 is policy support activities through promotional activities and the formation of health wellness clubs to include school gardening, nutrition and education, and physical activity. Next slide. Right, and pillar 4, monitoring and evaluation, which Fran mentioned briefly just now, the effect on school canteen concessionaires and vendors in and outside schools, a schools audit with selected classes, interviews with principals and PTA presidents, and monitoring and selected students. For a successful outcome of monitoring and evaluation, you need to conduct as systematically and impartially as possible, be continuous in the whole project cycle, and the expected results should identify high impact areas, engage stakeholders along the route, and adapt where necessary. Next slide. So very importantly, lessons learned, and we have 7 of them. Without a clear, strong central policy, the effectiveness of individual school initiatives was directly related to the school's resources, which is not very big, and the capacity and perceived authority of the principal. 2, unless vendors outside the schools were under the same guidelines, it's not an even playing field because the vendors on the inside have to pay where the vendors on the outside set up for free. 3, there must be implementation of policy-guided approaches around fundraising in schools, as this is a big thing for them, how they raise funds for the school. So they started looking at healthier alternatives rather than selling food. Some sold healthy products and others considered a fundraising day as opposed to every day. 4, there had to be sustained inclusion of education around good nutrition and the promotion of exercise to ensure that students were embracing healthier lifestyles. Next. 5, the effectiveness of the school policy to include strong monitoring and penalty systems, example, termination of contracts. 6, parents and teachers needed to be educated about the dangers of juices, as they, everybody knows that soft drinks are bad for you. It contains a lot of sugar, but the consensus was that juices were not. They were good because they contain fruit. So we had to teach parents all over again that juices are as high in sugar as the soft drinks. 7, practical vendor training and support resulted in encouraging levels of buy-in from the canteen concessionaires and vendors. Pre-COVID, there was compliance to the ban on sweet drinks, and canteens began to explore the alternative products, example, coconut water, homemade juices, etc. Final slide. And this is one of our model schools. After we did the outreach with them, they decided that they were going to do a march in calling for the school nutrition policy, which was very successfully done. And this was a clip from the newspaper. Thank you very much for listening.
Thank you so much, Jan, for that presentation. And I can say that the model schools for us at the Global Health Advocacy Incubator is definitely one of our best practices that we've documented. Stacia, over to you for the final presentation, and then we'll jump into the Q&A.
Thank you so much, Rachel. Okay, so I handle the communications, and our communications has run just as succinctly with our advocacy and our project management. And the communications is very important in Barbados. Next slide, Daniel, please. So in looking at communications, looking at the environment is always important. It has definitely been so in Barbados. So whether we look at the political environment, the economic environment, or the social landscape, it's always important to look at and be mindful of that. And we were definitely doing that from the time we started in 2019. So our political landscape, we've had a very active, a very hands-on Prime Minister who has definitely been paying attention to the messaging and the evidence-based research we have been using within the project. In 2021, we did our first mass media campaign on the sugar sweetened drink tax, and that resulted in the Prime Minister increasing the level of the sugar sweetened drink tax to the WHO threshold of 20% on soft drinks. And that was definitely a major win for us for the project. And that also resulted in a number of attacks from the food and bev industry. We also looked at social and public landscape. In 2019, going into 2020, everybody was responding to the COVID-19 environment. And definitely here in Barbados, health messaging grew exponentially. Everyone was concerned about the level of NCDs we have in Barbados. And that also, unwittingly to us, worked to our advantage because people were just more aware of the landscape, the health landscape, and Barbadians were aware that their family and friends who had NCDs were more vulnerable to COVID. And NCDs, obviously, that type of messaging is important to childhood obesity. And then for the first time, after the 2022 election, which happened in January of 2022, we had, for the first time ever in Barbados, a minister devoted to NCDs. And it helped that she was also a medical doctor. So her name is Dr. Sonia Brown. And she has definitely come on board and become more or less a ministerial advocate for us within childhood obesity prevention advocacy. And she has worked with us, as Francine said, in a number of areas, but definitely been a voice for childhood obesity in Barbados. Next slide. So we go on to messaging and earned media. And let me just say, the media in Barbados has definitely been so supportive of this project. They've always been very open and try to understand where we sit, what the evidence is saying, and how we are advocating for our children's health. And again, just on the cusp of our Out of Our Schools campaign, which was launched in October of 2022, we had a lot of work happening within the media and specifically from our coalition and our youth advocates. They became the voice of childhood obesity prevention, and we knew that also government, this government specifically, really listens to what the people are saying, what the people are saying on the radio. Radio continues to be a major media platform in Barbados. So it's always good to know what is the most popular and the strongest media platform within your environment. And we use that. And so our messaging about 1 in 3 children in Barbados being overweight or obese and 8 out of 10 deaths resulting from NCDs were things that Barbadians were hearing continuously. And that then led us to work a lot on digital media as well. So the story here on your left, overweight children, a worrying trend, that was actually a story that one of the main print media houses came to us and asked us about. So it turned into a situation of, rather than us going to the media all the time, they started to come to us to ask about the research, to ask about the evidence that we had and what was really happening with childhood obesity in Barbados. Next slide. So as I just said, radio has been a major platform and continues to be a major platform in Barbados. In 2019, 2020, we did have a change from just radio being a major platform to also digital and social media. So, but we have engaged radio quite a lot. Starcom Network is one of the key radio houses in Barbados, one of the key radio media houses in Barbados. And we have worked and they have supported a lot of our events and a lot of our stories that we needed to get out in the face of the school nutrition coming into being, and also in the face of a landscape where the food and bev industry was doing their own messaging. Next slide.
Barbadians are supporting calls
The
by
Barbados
the
Diabetes
childhood
Foundation.
Okay. So we also worked a lot with our youth advocates, as Francine said. Right. And in 2020, we did a day of action on Instagram and Twitter. And our youth put up graphics like what you're seeing here on our left, where they were tagging our ministers, our policy makers, our government ministers about wanting school food nutrition policy. And this worked so tremendously for us. We had about 12 to 15 youth on Instagram, on Twitter, talking about the need for school nutrition policy, saying they want the school environments to be healthier, saying they want a healthier space for their friends and siblings. So this worked to our advantage. We had an avalanche of digital action tagging all the policymakers. And you can go to the next slide, Daniel. And this was a wonderful example of how you can use social media to your benefit. We partnered with You Report Barbados on their platform. I had a live about it. And this also took place on World Health Day. At the time, our youth advocacy officer, Christopher Laurie, was the lead on this. And we even carried this into traditional media, where our traditional media partner, CBC, which is our TV station here in Barbados, also covered this whole day of action. Next slide. So as you can see, all our wonderful advocates doing their thing, showing their picture, and the words on the shirt also tells the story of we deserve better. Next slide. So these were the analytics we had for that day. And as you can see, the numbers were amazing for a population of about 300,000. This was the engagement that we had for that one day alone. And this was what led to the Ministry of Education asking I think they contacted Francine, asking about having the policy document for school nutrition policy to be presented to them and to work with PAHO on that document. So this was an amazing day and a major win for us. Next slide. Our digital advocacy from our coalition always helps. This is something that we've done from 2020 into 2021, where we use our coalition platforms like our Diabetes Foundation and Endometriosis Association. They helped in developing messaging that worked for them, that supported childhood obesity. So whether it was front of package warning labels or speaking about NCDs, and our BARP Association, which is the largest consumer group in Barbados, we use their platform to push out our messaging beyond who follows us. And this was a definite win as well. Next slide. Next slide. And last but not least, our Mythbusters. This was a campaign we launched in 2022, given that industry was pushing their own messaging about the results of the sugar sweetened drink tax. They said, there would be job losses. They said there would be no decrease in the overconsumption of sugary drinks. So what we did, we created a matrix showing that what comments were being said on the news stories about the tax. And then we debunked those comments, those belief systems. So we highlighted that we spent $375 million annually on NCD treatment. We decided that we showed you can't exercise away a bad diet, because we found that policymakers were pushing exercise, but at the end of the day, a bad diet is a bad diet. So all of these types of messaging became really important to us. We had support from our coalition members like Healthy Caribbean, who would repost and who would put out their own messaging as well. And this definitely has worked for us, and something we embrace and something we continue to look to see what we can do in a new way. And that's it. Thanks so much. And that's communications on school nutrition policy.
Thank you so much, Stacia. All right, we're going to jump straight into the Q&A section. I see quite a few questions coming in. I'm just going to ask Neola if you could post that in the main chat for me, please, because Stacia mentioned the use of the U-Report, and U-Report is an online polling data collection system that was created by UNICEF, actually, in Barbados and other countries globally. So if anyone is interested in partnering with UNICEF, it's really focused around getting information from young people about issues that affect them. And so, you know, this was a partnership with UNICEF. So I'll ask Nayola to share the link in the main chat so everyone can have the information about your report. All right, so let's get going. And start with the first question, which I believe was from Mariana. Okay, Francine specifically. Mariana has asked if there are any formal spaces of participation and dialogue where civil society and government can build consensus around regulation and other issues related to school meals program.
Oh, thanks. Great question. No, that's one of the areas for us that we have not seen that kind of formal space. But what we did as civil society was to create those spaces by requesting meetings. Every time we were about to move into a new policy or new campaign, we would actually request a meeting with the various ministers and their teams to be able to chat. We've also spent some time where we found that there was probably lack of information or gaps in the data and understanding the data. We would actually pull together a team from the coalition who had different expertise and actually request meetings, and created those spaces for a lot of dialogue.
Okay, thank you. And then this next question comes from Bibiana. Now, oh no, actually, sorry about that. It's not from Bibiana. Okay, I think Bibiana translated it. I'm not sure. Okay, I'm checking. Okay. It is from Bibiana. Okay, thanks. So it's about the monitoring application you created, and how did the implementation go? So it's not yet implemented, but I think there was a test, was there not?
We actually haven't tested, but what we have done is kind of walk through with, I saw the question that was asked, we walked through with the Ministry of Education to a certain level as to how it would unfold. And so the plan was that the ministry is going to identify education officers, which I believe they have already done. They may also identify some monitors within the schools who will have the app and be able to do the random monitoring. And in support to that, we will identify some civil society members who would be going into the schools to do the random monitoring. And we are going to identify which particular activities are being done, and be able to kind of systematically each month indicate what we are seeing in terms of the products that are being sold. So I hope that kind of answers the question, but we haven't been able to, I mean, we have tested in the sense that we have worked the app, so we know how the app works, but we haven't tested it in an environment, and we are hoping to be able to start that soon.
Fantastic. Okay, the next question is from Jonas, who notes that the school nutrition policy is amazing as an initiative for the Global South, but wants to know whether or not that there were any challenges that were posed from the industry.
Well, there were lots. I would let Stacia do it in the sense, share, because she's obviously tackling it at the media level. And if there's anything, we can always share some other very special experiences that we've had. Stacia.
We definitely had that very special experiences. The industry in Barbados, particularly, we would have seen it started during COVID, when they started to do giveaways to frontline workers and do giveaways to people who were suffering from NCDs and were really vulnerable health-wise. And that proliferation kept on going. They kept being associated with charities that were like Barbados Cancer and stuff like that. So that was always there. But then when you had the increase in the sugar sweetened drink tax, that brought it more to the front, where we had them doing their own. They launched a campaign of their own under the guise of being healthy, which is a playbook they do globally, and they did that here in Barbados. And they started to do messaging about there will be loss of jobs, as I said. They started to do messaging about it won't have any impact on how Barbadians consume sugary drinks. And they had like a whole lot of media stories on Barbadians loving sugar sweetened drinks. And it became almost endearing, and we knew we were fighting that. So we came back and went back with the research. We went back with what's happening on the ground. We went back with, this is something that is about protecting our kids. That's, it's World Health Organization recommended. And it's going to go with a suite of policies, not just one policy. So we just kept on reinforcing that message on every major platform that we could. And that worked to our benefit.
Absolutely. I think, Rachel, if I could just jump in. So at the media level and at the public level, they definitely went on the attack on the radio and so forth. But I think an important part was also attempting to have very specific meetings with the Ministry of Education and the Ministry of Health, indicating, of course, that civil society wasn't working with them. But again, because of those champion technocrats who were already very passionate and very clear as to what they wanted to achieve, we found that thing didn't mushroom into delaying the policy. And I think one of the experiences that we have seen now is that there's an attempt to infiltrate the schools, not with an education, but to come in with some of the healthier products. But when they come in to share the healthier products, they're also bringing the branding of the other products that are not so healthy, and also bringing some of those products as well to so there needs constant monitoring of that thing as we go along. One of the things I would say, though, and I want to thank Jamaica for this, was that one of the ways that I think we have managed to kind of nullify a lot of the efforts by the industry was that our team in Jamaica, Heart Foundation of Jamaica, had an approach when they started their reducing of sugary sweetened beverages in the schools. And we were able to adopt that from them, which was to share with the manufacturers and distributors, here's the nutrient profile for the first phase of the implementation. And please send in your products that fall into those guidelines. And we were able to do that, and to be able to then issue to all the canteens, this is the list of products that you can buy from these various distributors and manufacturers. And I think that has helped to kind of smoothen the waters at least for the time being.
Yeah, and I will say that, this is one of, I think, the benefits of being partners in this program, where we can learn from each other and we share information about, what strategies and tactics are working on the ground in other spaces where we are doing school nutrition policy advocacy. My next question is for Jan, specifically. Jan, what has the response really been like from parents? Did they find it easy to find the healthy snacks? I know Francine touched a little bit about, being proactive and sharing some options to them, but what has the response really been like in relation to the healthy snacks? And what kind of activities has the coalition been doing to support parents?
Okay, let me go from your second question first in terms of the coalition. They have been super, super. I can't even find the right word to say how they have been involved in this whole process with us. We have coalition members, they go out to outreaches at schools, they do PTA meetings, everything we call them to, they attend. They literally come out to do the presentations. The nutrition team that Fran would have mentioned just now is made up of our coalition members who are nutritionists, doctors, that kind of thing. And they have created the alternative snacks and beverage list. I mean, that research was a lot because they literally went out to every supermarket and fine tuned, looked at the shelves, shows the information. So that's just to give you a snapshot of some of what the coalition does. But they are with us every step of the way. They have been extremely supportive. In terms of the parent support, it was mixed. There are parents who said, yes, definitely, we're into this, we want this. Then there's some parents wondering, oh, what can we purchase? There are no healthy products out there. We help them with that. But as we spoke to them, as we met with them and we shared with them, they understood exactly how they can get it done. We also shared the our alternative snacks and beverage list with the schools so that they can share with the parents. So they have much better information now because their main thing was, what am I going to purchase? That is all they were interested in. What can I purchase to fit into this school nutrition policy? And that is what we have created for them. And you find that they have slowly but surely come around. Because at the end of the day, what we like to do is to keep it, this is about your children's health. And so I think that message is always good messaging to get through to them. And now we are giving them the tools to help them. So it's getting a whole lot easier.
Thanks, Jan. So I see the next question, and it's actually from Brian Payne, right? Brian is poking your brains here. And just to say that Brian actually works very closely with our partners in Barbados as a collaborator, one of those technocrats who Francine spoke about, who is very, very much engaged and is an advocate in their own right in the country and supports a lot of the work that they're doing. But Brian would like to know, in Barbados, since industry has such a strong seat at the table for discussions related to SSB tax, FOPL, and the school nutrition policy, how can the advocacy partners work with ministries to mitigate against the influence of industry?
Thank you very much for that question, Brian, although I feel you should be answering it. But no, on a serious note, I think one of the key things, and it's the work has already started, very wonderfully led by the Healthy Caribbean Coalition and with full support from us, and that is the need to develop some kind of COI, conflict of interest policy. That work is ongoing. We started it looking inwards first, obviously, as organizations, but I think there definitely is a requirement for there to be some kind of policy within government and ministries as to how they handle the development and then the implementation of policies that ensure that there is not any kind of untoward and excessive kind of demands from players that obviously will not benefit from the policy, or at least do not see themselves benefiting from the policy. And so I think that's the first one. And I think the one that we've been doing as well is just being a watchdog on the walls. And so when we do see those kinds of things, we also make sure that we call for meetings, we have personal discussions on the phones, and we make pushback because we say, we know it's happening, and we make pushback. And we've also found that also focusing on pushing forward with the policy as opposed to spending a lot of time delayed with their discussions has been also very helpful to us. We've moved on. When they come onto the radio programs and trying to, we come on, but we say, what is the issue here? The issue is that our children deserve better, and we've been able to push for the policy, beyond their involvement.
Thank you very much for that, Francine. Okay, next question in the chat. There was a question about the status of the policy in terms of whether or not it's binding as law in the country? How are you able, if there are any sanctions that can be applied? Is there any criminal liability or violation for policy principles? And I think this is an interesting question because it's always, it taps into some of the discussion around policy, legislation, regulation. So I will leave it open to you ladies to respond to that. And I would say add to that if, what sort of measures are being taken to move to the next steps of making sure the enforceability of the policies is quite strong.
Okay, so I'll let Jan answer the question in the blanket way, and then I'll explain some of the intricacies for going forward. She loves to see.
I'm not sure why she wants me to answer this because I'm sure she knows what my answer will be. Because as far as I'm concerned, if there is a policy and you don't follow it, there should be sanctions. But right now in Barbados, I think because of who we are in Barbados, there is not really that legal end that we can go to. All we can do right now is to go to the schools, see what they're doing, monitor the policy, and pass on the information to the relevant ministries, as they're the ones who would be the ones to say, okay, we're going to take it from here and we're going to deal with it. But as across the board, there is not a whole lot that we can do with it. One of the things I thought the policy should have said from the get-go is, if you are bold enough to say to me that you don't want any drinks at all with sugar in the schools, 100% sugar-free, then you should also be saying to me that children coming to school with the beverages, they're not going to be allowed on the plan. And that has not happened. So whereas the canteen concessionaires and vendors on the school compound can't sell the drinks with the added sugar, the vendors on the outside can sell, and children can still bring them into school. So the policies, it still needs a little bit of tighten up, but we're happy for a start.
Yeah, we took the start, but clearly the policy as a cabinet approved document is actually quite binding. Separate to the fact that you could also move now to aspects of the policy being turned into legislation, which is what we are trying to work on now. Definitely the marketing in schools, we need to see legislation around that. And we definitely need penalties and for breaches of selling drinks that are outside of the agreed products. What we have found is that our government, I think because of the smallness of our countries, always trying in their own way to straddle between, the various stakeholders, decided that they would try moral suasion as the first port of call in terms of breaches and penalties, and using the monitoring and evaluation process to do that. But I think all of us, there's no way that this could continue on ongoing without the components. So our advocacy beyond the implementation begins again, because we now are trying to identify, and we've had the help of GHAI, in how do we turn where in existing legislation, as well as where there's need for new legislation for the development, so that we can push forth for that now as the next step.
Yeah. Thank you very much for that, ladies. There's always that tricky line between how much a policy can actually do and what else is then required when it comes to legislative enforcement. But as Francine said, quite rightly and very importantly, it does set the framework for what the behavior should be, right? And there are mechanisms in place to monitor and enforce those behaviors. The next question I'd like to respond to. So there's a question in the chat in relation to the response from store owners and if there have been difficulties there. But I would like to add to that. Has there also been any challenges with other key groups like the canteen concessionaires, those persons who run the canteens in schools, vendors on the inside and on the outside? And I do believe I did read an article about some students also rebelling. I wonder if you guys could just share a bit, what the response has been or any difficulties from those specific stakeholder groups.
Yeah, in terms of the canteen concession, in terms of the canteen concessionaires and the vendors, the very first meeting that they attended, well, the first couple of meetings that they attended, the fair was always, what are the alternatives? Before we did the research and we realized there were quite a number, because we do have an 8-page document saying that these fall within what you can purchase. We didn't have that at first. So that caused us to go and do some research, but that was their main concern. What are the alternatives. And I think that that created fear in them. We did promise that we were going to work with them. So as the training went on and we were able to give more information on alternatives, not just what to purchase, but how to prepare healthier options. Our coalition members again came in, did the training. We did practical training. We literally showed them how to create the drinks, how to do foodstuffs. The fear became less and less. And at my last vendor session training in September, these guys are totally comfortable. They took the list, even with the brands noted on them, and they went a shopping. One of the distributors for some products, they do quite a number of the products. He called me, their marketing manager called me one day. He was so excited. He wanted to come to the training. They had submitted quite a few of their products, and he actually wanted to come to the training. So there's not a lot of, my thing is, we're trying to push other distributors to get on board, get healthy products. We haven't heard an outcry from them because, again, Barbados is small, and it's mainly the distributors. We know there may be 5 or 6 of them, of the big distributors, who bring in everything. So once they can keep that up, we'll be fine. But we haven't heard an outcry from them per se in terms of the products we have listed. But I think overall, our general, now comes the FOPWL. Now we're getting a lot of pushback, but that's a whole nother conversation for another day. But in terms of the canteen concessionaires and the vendors, I think they're a lot more comfortable now with the alternatives that we have shared with them, including the brands.
And Jan, the association, you may want to touch on that was formed outcoming canteen.
Oh, yes, absolutely. Out of all the vendor training sessions we had, they decided to do now a canteen concessionaire association. So all the information, we are in contact with the president. He has our cell numbers. He shoots questions at me every once in a while. He'll send me information on what schools are doing. So out of that came that. And we think that is a major, major win because they did not have that before.
Thank you. And so we don't have a lot of time yet, but I do want to actually touch a little bit on it. I know it's a whole different conversation, but maybe Francine, just very quickly on the relevance of the school nutrition policy and sort of the link between school nutrition policy and FOPWL advocacy, and how we're kind of twinning those two in terms of pushing for support for FOPL.
Absolutely. For us, because of the outcry initially from parents as to, what do we sell, what do we buy for our children, and so forth, we use the opportunity to say FOPL, WPL will make a lot of sense because it now helps us to identify cuts across policies. So now you know what should be in the schools and what shouldn't be in the schools. And we have found that because of that, we have found support from our technocrats within the Ministry of Education, because they realize that this is a very delicate part of their process. And so this will help. So we have tried to link it. Our fight for FOPWL is going to be a pretty hard one, but we think that in finding these areas that connect with the public, that makes them see, but this makes a lot of sense, that will help us over the hurdles that we're about to face. Right now, we are seeing a 75% support based on our last poll, 75% support for FOPWL. And so we're trying to leverage that and build upon it so people see practically how FOPWL makes sense. But we got a battle ahead of us.
All right, and this is the absolute last question, and the only reason I'm taking it is because it's coming from Vero. And it is, are there any plans to connect the current policy win with policies to increase access to nutritious foods in schools and school meal programs?
Absolutely. Actually, Brian, who's here, is very involved in that process. And there has been a link. So part of the policy actually speaks to the nutrient guidelines that will affect not just both what people can sell, but what the school meals program should look like. And they've already started quite a bit of work there with the Brian's department, National Nutrition Center, trying to begin to bring stronger and more efficient guidelines to the preparation of those school meals. And they actually have started a program where they share online what these meals and these new healthy meals are. So definitely. And then the next one is that we have started a push, and we've gotten one minister who's already beginning to champion this, which is to see a tax swap on healthier food, between healthier foods and unhealthier foods. Our mapping that was done by the University of the West Indies shows that right now our unhealthy foods that are being brought in, and our imports are the highest, or are high, are 30% higher than 30% lower than the taxes on the healthier products. And so we have called through a policy brief for a tax swap, and that's been is being championed. And so we hope to be able to push that forward next. I hope that answers the.
All right, thank you very much. Unfortunately, we're out of time. I want to thank everybody for participating in this webinar. Please feel free to send any additional questions, follow-ups that you have, and we will, of course, share the recording with you. Thank you all for joining us today. Have a wonderful day, and thank you, ladies, for being such wonderful panelists today.
Thank you very much. And you're being a wonderful moderator today. Thank you, Reed.
You can see we get along great here. Everyone, take care. Have a wonderful day.